Photodynamic therapy, called PDT, is a promising step forward in the treatment of certain types of cancer and some other diseases. While PDT is a relatively simple procedure, your role is very important. For the next few minutes, we'll explain how this innovative therapy works, what benefits you can expect from PDT, what side effects you should be aware of, and what you need to do to help PDT do its job. PDT has been shown to help individuals with diseases such as lung and esophageal cancer. For many of these patients, PDT can shrink tumors. In the early stages of certain lung cancers, PDT can eliminate diseased tissues completely. In later stages of some lung and esophageal cancers, it can make some patients more comfortable by easing symptoms such as shortness of breath or difficulty swallowing. The success of PDT therapy can depend on a number of things: what type of disease you have, how severe your condition is, your general health, and how well you follow the instructions given by your healthcare providers. Your doctor can tell you what the expected outcome is for you. Photodynamic therapy uses a combination of a drug that is activated by light, otherwise known as a photoactive drug, and light from a laser. Both work to allow the doctor to specifically target and destroy cancer cells while limiting damage to surrounding healthy tissue. Approximately 2 days before the PDT procedure, you'll be given the photoactive drug. If the drug is Photophrin, you should bring sunglasses, gloves, and a wide-brim hat with you to the hospital to protect against a photosensitivity reaction on your return home. We will also try to schedule your appointment early in the morning or late in the afternoon to minimize your exposure to light after you've received the drug. You may eat and drink normally on the day of your appointment. The nurse will insert an intravenous line and administer the drug. We will monitor you for side effects as necessary, and then you are free to go. Be sure to notify your nurse or doctor immediately if you have any unusual sensations. 2 to 3 days after you receive the drug, you will come back for the laser light application. By that time, much of the drug will be gone from the non-cancerous cells in your body. One of the main advantages of PDT is that the drug stays in cancer tissue longer, so diseased areas can be selectively treated. The laser light is delivered to the cancerous areas in one of 2 ways. If you have esophageal cancer, you'll have an endoscopy. If you have lung cancer, you'll have a bronchoscopy. Before the laser light procedure, it is important to avoid eating for at least 8 hours. To help you relax, you'll be given a sedative. Then the doctor will insert a flexible scope to deliver a precise amount of laser light to the cancerous tissue. The scope allows the doctor to actually see the cancerous area and to position the fiber optic instrument correctly. The light used in photodynamic therapy is non-thermal, meaning no heat is involved, so it can't burn you. You'll be given protective goggles to prevent accidental injury to your eyes, which will be light sensitive from the drug. After the scope is positioned, it will be left in place for several minutes while the laser light is directed at the tissue. During this time, you will be monitored and kept comfortable. Recovery from an endoscopy is usually brief, and we will observe you until you're ready to go home. Be sure to have someone drive you home from the hospital because the sedative may make you drowsy. When you arrive home, limit your activity and exposure to bright light and direct sunlight for the rest of the day. In some cases, the physician may feel it is in your best interest to stay longer at the hospital. A few days after the laser procedure, your doctor will want you to return for another endoscopy or bronchoscopy. This is necessary to evaluate the success of the treatment, to loosen any dead tissue, or to repeat the laser light exposure if your doctor feels it necessary. The benefits of PDT are seen as soon as 2 to 3 days after treatment. If you have symptoms such as shortness of breath or trouble swallowing, they will usually begin to improve in 2 to 3 days and continue to improve for several more days. These benefits of PDT often last for several months or longer. Your doctor will repeat the endoscopy or bronchoscopy a few weeks after PDT to evaluate your progress and may recommend repeating the therapy later on. It's important to be aware of the side effects of this procedure. Common side effects associated with PDT include local swelling and inflammation occurring in and around the treated area. This may cause physical discomfort, including pain in the chest or abdomen, and breathing difficulties. Other fairly common side effects include the following. If your esophagus is being treated, nausea, vomiting, fever, constipation, difficulty swallowing and sleeping, infection, and shortness of breath. If your lung is being treated, fever, bronchitis, and shortness of breath. Talk with your doctor about what you can expect. If the drug Photophrin is being used, photosensitivity will surely occur due to the continued presence of the drug in the skin. Photophrin causes photosensitivity because the drug collects in the skin immediately upon injection, as well as in the cancer cells. This means that from the moment you receive your Photophrin injection and for approximately 30 days thereafter, your skin and eyes will be very sensitive to bright light. Exposure to bright light or direct sunlight should therefore be avoided to prevent sunburn, redness, and swelling. Photosensitivity reactions can occur in minutes, so it is important to take precautions to shield your skin and eyes from exposure. You will be sensitive to light as soon as the drug is injected, so it's important to bring protective clothing to wear on the day you receive the drug. These include a wide-brimmed hat, a long-sleeved, tightly woven shirt, gloves, long pants, socks, full shoes, and dark sunglasses. To avoid a sensitivity reaction, avoid direct sunlight from skylights or undraped windows. Avoid bright light such as examination lamps, operating room lamps, reading lamps, and unshaded light bulbs at close proximity. Don't stay in a darkened room, as low levels of indoor light will help break down the drug in your skin and reduce photosensitivity. Wear protective clothing and very dark sunglasses outside, even on cloudy days or while in a car. Limit your outdoor activities to after sundown. Report any skin reactions you have to your doctor immediately. Don't rely on sunscreen or sunblock. It is not effective in preventing this type of skin reaction, no matter how high the SPF. Sunscreen only protects against ultraviolet light, which is invisible, and photoactivation is caused by visible light. You will need to protect yourself from light exposure as long as Photophrin remains in your skin, approximately 4 to 6 weeks. Your doctor or nurse will let you know the length of time you should take photosensitivity precautions. It depends on the drug you receive and also varies from person to person. However, do not limit yourself to a dark room. It is important to get some indoor light because low levels of light will help break down the drug in your skin and make you less photosensitive. About 30 days after you have PDT, you will do a light exposure test. Cut a 2-inch hole in a brown paper bag. Put your hand in the bag and expose only the unprotected patch to sunlight for 5 to 10 minutes, depending on your doctor's advice. If your hand does not turn red, blister, or swell after 24 hours, you may gradually increase your exposure to sunlight. If you do have a reaction, you must continue to take precautions for another 2 weeks before retesting. Your doctor or nurse can give you more information about photosensitivity precautions and the length of time you will need to take them. If you have had PDT to a visible area, such as the skin, you may notice that the area begins to look worse before it gets better. This is part of the healing process, and within a few days, you should see healthy new skin. Photophrin is not approved by the U.S. Food and Drug Administration for treatment of the skin. Keep in touch with your doctor or nurse after PDT to let them know how you are doing, and of course report any unexpected symptoms right away. Now, you have a better idea of what PDT is, what you can expect from the therapy, and how important your role is. You probably have more questions, so please share them with your doctor. Photodynamic therapy is a promising step forward for people with certain types of cancer and other diseases.